develop these. So. And it's just the supraglottic with additional force. There's also something called the effortful swallow, and the effortful swallow is much easier to do than the supraglottic because you don't have all of those steps. And really what you're just telling somebody to do is when you swallow, swallow real hard and squeeze with your tongue all the way along. So everybody just do that just on your saliva, or if you have something to drink, that's fine. But just try and push as hard as you can, like you're trying to swallow a ping pong ball. Can you feel the effort that you put behind that? So it's a little different than just your regular swallow, right? I don't know why. Somebody once said that. Swallow like you're swallowing a ping pong ball. It's amazing the things that stay in your head, right? Anyway, so I use it all the time. Swallow like you're swallowing a ping pong ball. Swallow hard. Okay. So the Mendelsohn is another maneuver. So the supraglottic is considered a maneuver, and the Mendelsohn is also a maneuver. And while the supraglottic is focused on holding your breath, which means holding your cords together, right? So for someone who has airway closure issues, that's a good, and can do that maneuver, that's a good maneuver to use. The Mendelsohn is more focused on laryngeal elevation, so focusing on getting that larynx up high. And what you do with the Mendelsohn is you swallow, and then at the point at which your larynx is at its highest point, you're going to hold it and then relax. So here's that one.
Next, we will see the sustained swallow technique in a patient with swallowing difficulties. The initial view is the patient performing the maneuver before any therapy. Note.
Well, let's try this again. Sorry. I was trying to make it bigger, but I guess I...
Next, we will see the sustained swallow technique in a patient with swallowing difficulties. The initial view is the patient performing the maneuver before any therapy. Note that while the patient is able to maintain a sustained swallow, there is penetration and some aspiration into the airway and residue along the posterior pharyngeal wall, tongue base, and in the molecular. We even note a small amount of NP reflux in this individual. Following 1 month of therapy using this maneuver, we see the same patient again. Note that the sustained swallow occurs for a longer duration and that there is less residue, less penetration into the endolarynx, and no evidence of aspiration or NP reflux.
So this person's holding their larynx up here, right? Getting a tiny bit of maybe, but barely, that's probably right under the epiglottis. And let's go, and there's nothing. That was penetrating. But it came out, it squeezed out. So did you all see how the patient was kind of holding their larynx up?